Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome back.
Yes.
Today we're going to talk about Invisalign. I actually went to a course in Portland on Invisalign over the weekend, and it got me thinking about one of the most common issues that I see in patients' dentition. So when people come in, often we are doing a 3D scan of their teeth with just a little camera, and then on a screen we can see the image of your teeth in 3D.
Right.
And one of the things it offers us is something called an occlusogram. So it shows when you're biting down where the heavy bite is in your mouth. So like, are you contacting more heavily on your front teeth or your back teeth?
Right.
Kind of like a heat map.
It's like a heat map, but the hot parts are where you're biting the hardest.
Where you're touching a lot. Yeah, exactly. So it'll show us literally in color. So where you're biting the hardest, or you have the most contact, it's red, and then it's so far. And what we really want in a normal set of teeth is that when you bite down like that normally, and you clench down your back teeth, that only your back teeth are touching.
Right.
And that there is a little bit of a gap between your front teeth on the top and the bottom. So there's a little space between them.
Well,
that's what we
between
want.
not like a space where your front teeth are not overlapping, but we want a space between the back part of your top teeth and the front part of your lower teeth.
Yes.
But we still want your upper teeth to come over your lower teeth.
Totally, yeah. We don't want you to have an open bite.
Right.
We want your teeth to overlap a little bit. So ideally, and some people come in and ask me that, like, my teeth are on top of each other. Yes, we want you to have a little bit of an overbite, right? So we want the front teeth to be a little bit in front of the back teeth and a little bit covering over top. So there's a bit of overlap this way as well. But we don't want them to touch each other when you do that. And some of the issues that causes is you get a lot of wear and tear on the bottom teeth at the top edges of your lower front teeth. If you're somebody that has chipping and wear there, that's because your occlusion is too tight and your top teeth are touching your lower front teeth when you bite down. The other thing it causes is temporomandibular joint problems. So if you are having pain in your jaw joints, if you're waking up with headaches, if you have migraines, one of the causes of that can be this, because often our lower jaw wants to be a little more forward. So our lower jaw is sitting and is attached to our head. It's not actually attached to the skull of our head with bone. It's attached to it with muscles and ligaments. Right.
Like the lower jaw is kind of like loose, and the upper jaw is really part of your skull.
Fixed. Yes, your upper jaw is part of your skull. Your lower jaw is just like hanging there.
Like hanging there by these ligaments, and that's why you can open and close and move your jaw around and forward and back.
Yes.
It's actually not attached by bone to your head.
It's not, but it needs a little bit of space for movement. It's actually the joint that holds your lower jaw to your head, basically, is this bone that is sitting, it's like a semicircular bone, and then your jaw joint is like a little ball, and it sits inside of here, and as you open and close your mouth, it rotates in there, and there's like a little cushion in there of cartilage, kind of like what's in your ear, that's sitting in between, that's cushioning this ball and socket joint that's rotating. So what happens to us sometimes is if our lower jaw wants to be a little more forward and it can't be because of our upper teeth, because maybe our upper teeth are inclined in, maybe our upper teeth are crooked and they're like facing in. So this forces, when you bite down, your lower jaw to go up and back. And so that ligament, that ligament over there gets squished, that cartilage gets squished, and you might have, that's how you end up with like joint pain often, right? So you have, maybe when you open and close your mouth, you hear popping or clicking, or you get up with headaches and just
or it's
like
just
a
like
tense
kind
jaw.
of like tense and like tight in the mornings.
Yes, because your muscles are trying to kind of relieve that, so they're trying to push your jaw forward to give you more space back there, but they're kind of locked into place. So your muscles are overacting. That's why you get tender muscles, the muscles of mastication, which are when you clench down this big muscle over here called the masseter, and there's another one that sits over here called your temporalis. It starts here sort of in your temple, and then it attaches down here.
Yeah,
And
it's like a big fan. And people do get headaches like kind of all in the side of your face, and that is the temporalis muscle. That it's like a big fan that goes like over your skull and then attaches down here.
Yes, so side of the head, headaches,
Yeah.
tension in the muscles here in your cheek,
Yes.
clicking and popping, and often this has to do with your lower jaw not having enough room in there. Another thing that I notice is people who had braces when they were younger, and often people who had 4 premolars extracted. So nowadays, even though premolar extractions, which are the tooth right behind your canine or your eye tooth, is your premolar. And often orthodontists would pull these 4 teeth, 1 in each quadrant of your mouth, in order to kind of align your teeth. But what happens with that, like let's say you have some crowding in your mouth, your teeth are overlapped.
Right.
So the way to resolve that would be pull these 4 teeth and then bring everything back to close the space. The issue that causes in a lot of people is that that's too much retraction or too much pulling back of the upper teeth, and that ends up locking the lower jaw a little further back than it wants to be. So over the years, that ends up causing TMJ issues for these people.
I think nowadays the philosophy has shifted a little bit to more expansion.
Yes.
Like pushing out the teeth and kind of expanding rather than taking teeth out and bringing and retracting.
Yes, yes.
So, but it depends on every case. Like we're not saying that you
It's
should
always
never
wrong.
take teeth out.
No, but the philosophy has definitely changed. The
Yes.
issue with 4 extractions is that we have to consolidate that space no matter what. Maybe you didn't need that much room as what 4 teeth make, but because teeth are a certain size, when you pull 4 teeth,
Right.
now you have to pull all of the teeth back that much, but maybe you only needed like a little bit of space,
Yeah,
you know?
yeah.
And so that's one of the issues that it causes. So if you're someone that had premolar extractions and now you're having TMJ or pain issues, you know, it could be that we just need to do some Invisalign and like move your teeth forward again a little bit.
That
So-
was exactly me. That was me.
That's what we
I
did
had
for you.
4 premolar extractions, and then as an adult, I didn't have TMJ issues, but my
you had
smile, I had wear, and my smile was always like kind of in.
tucked in.
So I actually did Invisalign and brought my teeth forward
Yes.
and created that room and all the stuff that we're talking about.
Yeah,
So,
exactly. And that's one of the things I do a lot of people who come in and they have TMJ or they have wear on their lower front teeth. They've really ground their teeth down. And I see that, you know, that they've had premolars extracted. So I actually pull the teeth forward.
Right.
Now that creates a space behind certain areas in your mouth. And we can talk about like, what do we do about that space? Do we
Right.
leave it? Do we do a little bonding on it? Do we make a big space and place an implant? Often not necessary, but
Right.
you know, those questions that we can answer. But the goal here is to give your lower jaw a little bit more room. So, and then the lower jaw, and as you pull the upper teeth forward, it's interesting. You know, we plan to pull the upper teeth forward, and then you think, oh, I'm making space. But what happens when they come back and you check them is that, wait, I still don't have space.
There's
What
no
happened?
space.
Because the lower jaw shifted forward along with it. It wanted to be
Yeah,
forward,
it
and you're going,
needed it.
oh wait, I gotta make more
It was
space.
like, yes, I can move now.
Yes, and so people are like, it's not working, I'm still touching. I'm like, well, it is working, but your lower jaw is going to where it wants to, it's going to where it belongs,
Right,
a little
right,
further
right. It's
forward.
trying to go.
So now we need to shift the upper teeth maybe a bit more to accommodate it again. But that's good, that's a positive thing. That means that
Yes.
the therapy is working, the clear aligner therapy. So, you know, Invisalign, orthodontics, clear aligners, they can be for cosmetic reasons, but often it's functional. And these things harmonize together, you know?
Yes.
What looks right also feels better, you know, and
Yes.
functions better. So
We
these
always
things
talk
go hand
about
in
when
hand.
things are healthy and working well, that's when they look good too. When
Totally,
things
yeah.
are in harmony and working well together, that's when your smile's gonna look good, your
Right.
jaw's gonna feel good, you
Yeah.
know, all this stuff's gonna come together.
Yes.
That's our goal.
Totally. And then,
Yeah.
you know, we didn't talk about it, but periodontally, like if your teeth are crowded in, you get more gum inflammation because more bacteria is trapping around these teeth that are overlapped. So just aligning somebody's teeth and straightening them out can sometimes eliminate this chronic gingivitis or gum
Yes.
disease that they've had, you know.
Bleeding and all this kind
Bleeding,
of stuff.
puffy gums,
Yeah.
you know, more incidence of cavities. it's just better when you iron out these teeth and straighten them out for your health, how it looks, how it functions, any joint and pain issues. Yeah.
Yeah, it's amazing. Like if you let the body work how it was supposed to work.
Totally.
And try to help it to get there, kind of. That's the goal.
Totally. So think about that. Sometimes people come in and say, I don't care about how it looks. Like I'm not worried about the look. And it's like, well, there's function aspects as well.
Absolutely.
So think about
if you
orthodontics
are someone who has
way.
TMJ issues, maybe if you have like crowded teeth or your upper jaw is too in, that might be the answer to getting some relief.
And it's the number one comment from patients when we start Invisalign is, oh, I used to have, the ones that used to have issues in their jaw, they're like, oh, I feel a lot better since starting Invisalign. So it can be a really positive side effect. Sometimes we're doing it for cosmetic reasons to straighten things up, but they're like, you know what, it actually helped this issue I was having as well. That's a good thing.
Okay, well, hopefully that was helpful.
Yes.
And as always, you can get a free virtual consultation with one of us on our website, ladentalclinic.com.
Yeah, see you there.
Okay, bye.
Thank you for listening to The Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.